This is Pamela Jones. I'm a health promotions nurse with Boone Hospital Centers Wellaware, and I'm out here at Stevens Lake Park to talk to you about some sun safety tips. The ingredients in the sunscreen that can cause sensitivity is PABA and benzophenones. With children, any children under the age of 6 months old, they really do not recommend sunscreen. The reason for that is because the children at that age are not mobile, and so they really cannot move. If they are out in the sunlight, they can't really be able to move if they feel too warm. So it's really recommended to just keep them out of direct sunlight, period. However, it is okay to use sunscreen in moderation on kiddos that young, like maybe on the hands or a little bit on their cheeks, but it's not a good idea for kids under 6 months of age. Now, your older kids, like your toddlers and things, they can use sunscreen just like adults can. Well, there is a mnemonic. It's called slip, slop, slap, and wrap. So slip on a shirt. The thought behind that is shirts, the darker the color and the tighter the weave on the material can block out UV rays. And so they say to slip on a shirt if you're going to be in the sun. Slop on some sunscreen, and so that's one way to protect yourself. Slap on a hat, and then wrap on some sunglasses to protect your eyes and the sensitive skin around the eyes. American Melanoma Foundation, they say that sunscreen with SPF of 15 is fine for everyday use, and then the American Academy of Dermatology recommends an SPF of 30 sunscreen. So anywhere from 15 to 30 is good, and then when you have long sun exposure, wearing the clothing and the hat and putting on the sunscreens is really your best bet to prevent against UV damage. Well, there's two types of products. You can get sunblock and then there's sunscreen. Sunblock is usually thicker and a creamier substance. It's not as cosmetic friendly because it's usually white in color and it doesn't rub in a whole lot. But it has the zinc oxide in it, or the titanium dioxide, which actually when the sunlight hits that cream, it will not reflect any of the sun burning UV rays, but it will kind of scatter the light. And so that's more of your sunblock. And then sunscreen, which is more typical of what I think we're used to seeing in stores and stuff, they are chemical UVA and UVB blocking agents. And they can come in creams, sprays, ointments, gels, things of that nature. And the chemical UV blocks are what you're going to find in cosmetic like makeup and stuff. SPF 15 does block out about 93% of UV rays, and SPF 30 will block out about 97%, and then your SPF of 50 is up to 100 is more of 98 to 99%. So percentage-wise, there's not a whole lot more filtering of rays that happen when you go from a SPF of 15 to 100. So generally speaking, I would say an everyday use of 15 to 30 you'll be fine as long as you put enough of it on. If you're going to be out in the sun for at least 20 minutes or longer, you should consider using sunscreen. Gel sunscreens tend to not stay on as well as your creams or your sprays. And then moisture. If you're going to be sweating a lot or in the water, you should get a sunscreen that is water resistant or waterproof. The difference between those, and it'll say on the bottle, your water resistant sunscreens will last about 40 minutes of being in the water, and waterproof sunscreens, you're looking at about 80 minutes of protection being in the water. Well, from direct sunlight, you can break it up into 3 categories based on the wavelength of the light rays. So you've got your visible light, you've got your infrared, and then you have your ultraviolet radiation. So those are the 3 types. And then under the ultraviolet radiation, it further breaks down into 3 more types: your UVA, your UVB, and your UVC. You don't hear a lot about UVC because it is the most dangerous form of ultraviolet radiation, but the ozone pretty much takes care of scattering that enough that it doesn't reach people, you know, on the planet. Your UVA are your deeper penetrating rays, and those are the rays that don't necessarily cause sunburn, but they do cause the premature aging and the wrinkles. And then your UVB is more skin penetrating, and it's the culprit for sunburning.